Hello and welcome everyone to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon. Thanks for listening. In this episode, we'll be discussing maternal health, reproductive rights, and justice. We'll learn about what can be done to address social inequalities around maternal health and reproductive rights, whether as an activist or as a storyteller and filmmaker. We'll also discuss how to stay positive regarding women's rights in the political climate. First, we'll hear from Dr. Deborah Kaplan, a public health leader, advisor, and consultant with expertise in maternal, infant, sexual, and reproductive health, prioritizing racial and gender equality in perinatal outcomes. Currently teaching as an adjunct associate professor at CUNY SPH, Deborah has over 40 years of public health experience in clinical care, health education, program and policy development and advocacy, and program leadership. She is the former Assistant Commissioner of the Bureau of Maternal, Infant, and Reproductive Health at the New York City Department of Health and Mental Hygiene. She's also served on the Women and Gender Subcommittee of the Institute for Medicaid Innovation, is a member of the Postpartum Awareness Day Campaign Collective, and is a board member of the ARIA Foundation. Deborah is committed to actively speaking out and participating in efforts to dismantle structural racism, gender oppression, patriarchy, white supremacy, and wealth inequality as the root causes of health inequalities affecting people of color, with a focus on inequities in perinatal, reproductive, and sexual health outcomes. For her efforts, she was recently appointed by New York State to be a member of the Unmet Health and Resource Needs Facing Pregnant Women Task Force. Deb, thanks for joining me today.
My pleasure to be here. Thanks for inviting me.
So, Deb, you have a lot of experience working with the health department and in different organizations related to maternal health. How did you get involved in this type of work, and why is it so important to you?
Well, I guess I'll highlight two main things. One is I was at City College. I'm a CUNY undergrad and grad, both my master's and doctoral degree, and 2 years of undergraduate. And I was reading and learning about barefoot doctors in China. And I thought, what would be a way to provide healthcare services to people who are marginalized and under-resourced that is not going through medical school, and learned about being a physician assistant. So I started in the health field as a physician assistant. And my very first job was at Jacobi Hospital in the Bronx, one of our public hospitals. And my very first patient was a man, probably in his 50s, complaining that he was having trouble breathing. And this was the walk-in clinic. He had waited 3 or 4 hours to be seen. It was a very crowded clinic. I did a workup. We used to do everything ourselves. He was in heart failure, congestive heart failure. And I wheeled him to the emergency room. Later that day, I checked on him and they told me that he had passed away. And I was right away like, wait a minute, what is wrong with this picture? Why would a man wait and sit for hours on his last day of life in critical care? And I started asking a lot of questions. I heard about public health and realized over several years as a PA that my calling was much more looking at policy and program and citywide and community-wide population level work than the one-on-one patient care. Though I feel so glad I did the work as a PA because I never forget that man, and I never forget staying grounded to what this is all about and who this is about and the inequities and communities that have been disinvested in over many years and generations. So that was one piece of just going into public health. And the other is I came of age when abortion became legal in New York State, which was 3 years before Roe v. Wade. So 1970. New York was one of the first states to legalize abortion. And interestingly, part of what made that happen was the person who had the job I later had as assistant commissioner at the city health department, because she documented maternal death from illegal abortions. And she was able then to show from 1970 to 1973 when Roe v. Wade passed, and now here we are full circle to it being gone, she was able to document the marked reduction in maternal deaths between 1970 and 1973 in New York. From the time it became legal in New York, helped make the case. And there's data that shows that dramatic reduction, that people just stopped dying from abortions almost practically completely. So I became very interested in that time as a teenager in sexual and reproductive health, both personally, of course, and politically. That was when the women's movement was happening. And I read The First Our Bodies Ourselves, which was 25 cents. It was almost like an underground book about your body and learning about body parts that Women never learned about them, what they looked like. And it became a passion for me. And it's really been a through line in my work. I would always say, once I ended up at the health department in the Bureau of Maternal and Reproductive Health, that people would say, are you looking for other jobs here? No, the only place I wanted to work was maternal child sexual and reproductive health. Just two other things to add is when I was at Jacobi Hospital in the 70s, I joined an organization called CARASA, which was Committee for Abortion Rights and Against Sterilization Abuse. And so while I didn't know what reproductive justice was, and that term hadn't even been created yet by Black women in the 90s, I understood that we couldn't just talk about abortion and that we had to talk about sterilization abuse, and that people, particularly people of color, were being sterilized without their knowledge or consent. And lastly, when I was a PA in a school-based health center in an elementary school, I offered with a guidance counselor to provide sex ed to 5th and 6th graders. And one of the biggest ahas, which made me a champion of sex ed, was when we had a question box for young people to ask questions, whatever they wanted to ask anonymously. And kids were asking these questions about sex that showed that they had all this incorrect information and they were so afraid of their sexuality. And it just made it clear to me that we have to start early and that sex ed is an important part of what I care about.
It definitely is. And since retiring from the health department, you've been working in majority Black spaces. Why is that an intentional choice for you to do multiracial work to address inequities?
Well, I have to say that's been a process over time. When I was at the health department, I was there for 21 years. In the period towards the last decade I was there, Dr. Mary Bassett became the health commissioner. And she'd actually been my boss previous to that when she was a deputy commissioner, and actually was the one who promoted me to be an assistant commissioner, which I'm forever grateful for. She brought to the health department the conversation about racism, and that we were obliged to talk about the root causes of the health disparities that the health department always talked about, but never talked about why. Why are we seeing these health disparities? And when you don't talk about it, you leave open the blaming of the individual and making this about individuals not taking care of themselves and whatever, and all the myths and all the racist ideas we have that we've all been indoctrinated with in our culture. And so she insisted that we talk about racism. I went to many trainings, and here I was a leader, a white woman who's a leader of a bureau of about 200 people, mostly women of color. And though most of my directors were women or men of color and people I had promoted very intentionally in thinking about having a diverse leadership in my bureau, I was leading the bureau. And the health department, like many institutions, was primarily the people who were at the top, in this case, not the commissioner, but were white. And I became more and more aware of my privilege as a white woman just by the color of my skin, how I show up in spaces. Nobody's watching to see if I'm stealing when I go to a store, and became more and more aware of what my privilege was in growing up as a white person and not having to face the day-to-day insults of racism. And I saw that as part of my leadership as talking about that. When I became more and more aware of the importance of me as a white person talking about racism and also talking about my privilege and talking about those together, and making sure I always talked about the root causes of inequities and framing it as inequities, not as a disparity, it's just a difference. But inequity speaks to the social conditions that make people have different outcomes. And so when I retired, one of the areas that I got much more involved in while I was at the health department was maternal health, because I came from Planned Parenthood, I came from sex ed. My experience and my expertise and all my connections were around sexual and reproductive health and pregnancy prevention and abortion, not maternal health. But when I started seeing the data, reading more about maternal health and learning about the disparities and inequities racially, I would say I'm shocked, but not surprised. We should be shocked. It's so unacceptable that in New York City, Black women are 9 times more likely to die of a pregnancy-related cause than white women. In a city with some of the best medical institutions in the nation, supposedly. And I believe it's now 38 maternity hospitals.
And one of the most diverse cities in the world, really.
Exactly. And our racial inequities are much worse than the nations. The nations are unacceptable. Black women are 2 to 3 times more likely to die than white women, but 9 times in New York City. So when I left the health department, I felt that the area around maternal mortality and the really public health emergency, as I see it, of people dying, and we now know from the CDC that 80% of those deaths are preventable. So we have women of childbearing age who are dying and whose children are left without a mother. And what's happened over the last 10 years is many more reproductive justice organizations that are led by Black women have been very involved in the maternal mortality work and taking leadership. And one thing I learned about reproductive justice is that we really need to center the most marginalized. I'm not the one to be centered. And as I saw leadership developing from Black women, I felt a role I could play is to bring my knowledge and skills to participate with Black women-led organizations and to really be in the position of a learner and navigating, which I've learned, and it's been a process, my role where I'm not a leader. I don't want to be the leader. I'm not deciding the agenda, but I am bringing my full self and authentic self to the space and finding that balance where I step back, making sure I'm not centering myself, but that I'm also not just there to show up and say, hi, I'm here. I'm actually an active participant. And that's a process of learning how to be in that role. And it's a humbling experience about really constantly checking in with myself and what are my intentions and why am I here? And so now I'm very involved in that work and very heartened by all the achievements around the country in cities and states in particular that are Black women led. I want to say one thing about maternal health. We use the word maternal health. And the fact is, most people who are capable of pregnancy and get pregnant are women and identify as women. But it's really important to note that people who can become pregnant and pregnant people are a group that, while mostly women, also include transgender men and non-binary people. I'm of the belief that it's important to mention women, not to just say pregnant people, but to make clear that we're not just talking about women and that we include the most marginalized people who can become pregnant as well.
Absolutely. And so let's talk about the state of maternal reproductive health today. Here in the United States, we have our own political issues and a lot of people are trying to navigate them. Some pregnant people are having to cross state lines to get abortions or healthcare. How is reproductive justice being impacted, and what is the state of maternal and reproductive health globally?
Just last month, the Arizona Supreme Court officially reinstated a law from 1864, which bans abortions with no exceptions, even in the case of rape or incest, unless the pregnant person's life is in peril.
Oh boy.
We're going back to the 1800s.
Oh, no.
And let us be clear that this is not about caring about people who give birth. This is not about caring about babies. This is about power and control and maintaining white supremacy, a white male-led and controlled society, and doing that by controlling the reproductive capacity of women and other people who get pregnant. So we need to be very clear. This is not about the right to life. This is about the right to control women and other people who can give birth. So this and many other states have taken action since Dobbs and the reversal, where they had laws that could immediately go into effect should Roe be overturned as it was. And interestingly, there has been no decrease in abortion since Dobbs went into effect. What has changed is the kind of abortion people get. People have really mobilized and made sure that people had access to medication abortion, because there's two ways we can get abortions, both by medication that does not even require going to a clinic and can be made available through the mail, can be made available through a provider pulling in a prescription to the pharmacy, and then a surgical procedure, which is a very safe procedure, especially in the first trimester of abortion. And so more and more people are choosing by necessity, but also perhaps this is a preferred choice and it's more accessible because of many reproductive rights and justice folks organizing the medication abortion now. So abortion is still available, even for people who are out of state. New York State has one of the most progressive abortion laws, though I should say it will be on the ballot in November. And it's important that people know to vote, because we need to codify and protect abortion as much as possible in New York and other states where we have a blue state. Everyone should vote, and not just vote for president and their local candidates, but be aware of and spread the word that we have a chance to vote to make New York even safer for reproductive rights around abortion. So what's changed in the positive is that while some states have made regressive laws and more restrictions, and this is the most extreme, what happened in Arizona, there are other states who strengthened their laws to make abortion protected in their state. I'm very proud to say that the New York City Health Department created an abortion hub where people can call from anywhere in the country. And there are many languages, if they don't speak English, that are available, and can find out where they can access an abortion, find out about funds that are available if they need to travel. And also New York has protection for providers who mail someone medication in a state where it's illegal, so that doctors can feel okay and not worry about losing their license over making someone have the right to abortion. Another key thing that's happened is something that the right wing has been wanting to do for a long time, called fetal personhood. And this idea of making even an embryo, even a fertilized egg, or that, such as with in vitro fertilization, another terrible law that got passed in Alabama that considers embryos people. And this has been contested. I'm hopeful that it will be overturned. But what has happened is that this has led to an attack on in vitro fertilization. It has also led to increased criminalization of pregnant women and other pregnant people, where someone who has a miscarriage, and if she had marijuana in her system, just as an example, she could be incarcerated and be told that she killed her quote unquote baby, which may have been a very early pregnancy, or a stillbirth, someone could be accused. So there's also been this increase in criminalization. And this is particularly happening to Black and brown women and birthing people or pregnant people who have wanted pregnancies and are being criminalized. The hopeful news is that people have been mobilized. There's an organization called Pregnancy Justice of lawyers who are going around the country defending people who've been either incarcerated or accused of criminal acts. All of this is within the framework of reproductive justice. The terminology, reproductive justice, was established by Black women in 1994. And it came about because of, in part, the white women-led movement, which was only looking at the issue of abortion and contraception. And it did not speak in any way to the lived experiences of the more marginalized communities, particularly Black and brown women, who were often being denied the right to bear children or were being sterilized without their consent, even in New York City into the early 1970s. And that's still happening in parts of our country as recently as the early 2000s. So reproductive justice then became something that spoke to the overall lived experiences of marginalized communities, particularly Black and brown women, but it really speaks to everyone. The concept of reproductive justice builds on human rights that has been established all over the world globally. It basically is about a woman's or a pregnant person's right to decide whether to have children, whether to not have children, and to raise their children in a safe environment, free from any violence from the state or others. And it's also about bodily autonomy, the right to make decisions about your own body. And so it is a broad analysis that incorporates all the decisions around our sexual and reproductive health. And I think it's a framework that really helps us understand what's going on now with Dobbs, with abortion, with people being denied their human right to decide whether or not to have children, and if so, if to have children, not to be criminalized or raise their children safely. Globally, the reproductive justice framework and Sister Song Women of Color Collective for Reproductive Justice came out with a statement. Their executive director, Monica Simpson, talked about what's going on right now in Gaza, in the Middle East, and reproductive justice. And we know that with over 32,000 at this point, deaths of people in Gaza, over 13,000 of them are children. There's been an increase in miscarriages. People giving birth do not have access to basic prenatal care, to childbirth. We've heard of C-sections where people don't have anesthesia. So this is a reproductive justice issue. This is denying people the right to raise their children in a safe environment, clearly where genocide is occurring. While this is a horrific situation right now, I've actually personally been involved in protests around calling for a permanent ceasefire, as Sister Song does, and they make very clearly that calling for a ceasefire is a key cry for reproductive justice, for the basic human rights of women and babies and children. And they note, and I agree, that this is happening in other parts of our world as well. Haiti, parts of Africa, many other parts of the world. This is not unique and only to Gaza. But right now, this is a genocide happening in part of our world. And it's important that those of us who believe in reproductive justice and who believe in human rights and basic humanity speak out. Some people who are speaking out about reproductive justice globally are risking losing their jobs. I'm in a position where I don't have to worry about that because I'm retired and I'm using my platform as much as I can as a Jewish woman. The saying that resonates for me more than any other is never again means never again for anyone. I have ancestors who were killed in the Holocaust, in concentration camps. I feel it's very important for me as a Jew to speak out both against the genocide and what's going on in general and what the Israeli government is doing and our government support of it, and making that connection to reproductive justice and how war has the worst impact on women and children. And this is what we're seeing right now in the Middle East and other parts of the world.
And so what are the intersections between what's going on in the world politically and public health?
I talk about this in class all the time. How is this about public health and how is this connected? So public health predominantly focuses on health equity, on the right of all people to have access to the resources and the information they need to make informed decisions about their lives and to act on those decisions, and to the right to be able to live in a healthy, safe environment with the resources you need to lead a healthy life. So in public health, we talk a lot about the social determinants of health, about housing, and about how because of structural racism or the racism that is embedded in all the systems in our society, communities of color have been intentionally disinvested in. One example is redlining, where there were literally lines drawn around Black communities that were predominantly Black and brown, and banks stopped investing and allowed those communities to deteriorate, meaning that to this day, communities that are predominantly Black and brown people have unemployment, the worst housing, have the lowest tax base, which means the schools have less resources. And these all contribute, and as does racism, to chronic stress, which has been documented to lead to many conditions like hypertension and diabetes and other chronic illnesses, as well as complications of pregnancy. So we know that when we look at racial inequities in maternal outcomes and pregnancy outcomes, that a key part of why Black women are more likely to have complications or to die is because of structural racism and the impact of the day-to-day wear to tear on the body, on the ability to carry a pregnancy to term, on the complications of pregnancy. In our country, what's going on now with the Dobbs decision with marked reduction in access, meaning that people, if they may not be able to have an abortion if they want to not continue their pregnancy, or it will be much later in pregnancy when there's more risk of complication. Then the criminalization of pregnancy means that people are not able to just have a healthy pregnancy, carry their pregnancy to term, bond with their child. Children are removed from parents because they are allegedly abusing or neglecting their child, even when something like marijuana is found in their urine. When I was at the health department, we were finding out that was still happening in New York. So my guess is it may still be happening. And deciding who can be a good parent means that we are denying the public the right to have a healthy baby and raise their child and have their child receive the resources they need to not just survive, but thrive. And I would say globally as well that public health really, to me, is about human rights. And it is an activist philosophy that we need to take. Data to action is a mantra of public health, and it certainly was at the health department, that we need to address population health through understanding what are the causes of poor health and then taking action. So if we understand the root causes to be structural racism, but also patriarchy, we talked earlier about why the right wing is against abortion and this idea of controlling women's bodies. This has always been about controlling women's bodies way back to enslavement and slavery. All of these issues and the desire to control the reproductive capacity of people in our society and decide whose pregnancies are valued and whose are not totally affects health of women and other people who can get pregnant, affects the health of children. This is top number one priority, in my opinion, around public health. And it's only been recently that public health has taken a real key role in investing in this issue and understanding it as the crisis that it is.
So in times of political darkness and bleakness, with disparities increasing around the world, how do you keep hope for public health?
I think we have to have a vision of the world we want to live in, our North Star. I see a future, and we have to dream that future because, it's never existed in this country and many other countries. And so the vision of the future is one where all people have the information resources they need to decide if or when they want to have children and to have healthy pregnancies and have beautiful experiences giving birth and live in safe and healthy environments where everyone can thrive, children and families. And that's the vision to me. And I believe we can get there. I don't think I'm going to live to see that day, but I think I can do my part and we all can do our part to move towards that. We need to remember the successes and the victories that we have had over generations of time, from the end of slavery to Black Lives Matter, to more and more white people understanding the role of racism, to victories in the states around abortion and strengthening laws, even in some of the red states. And I look to the work that is happening at the local level. I really believe in that saying, act local, think global. I've discovered through my work with the National Postpartum Awareness Day Collective work that's happening led by Black women all over the country. In California, for example, Black women-led organizations and a coalition worked with their legislation to pass their own Momnibus, which is a number of legislation that was passed to assure reproductive justice, to protect pregnancies, including for women who are incarcerated, and a number of other laws. I've learned about a Momnibus that was passed in Colorado. I've learned about a reproductive justice work happening in Detroit, Michigan, where this spring, and it may already have been launched, will be the first Black midwife owned and led birthing center in Detroit, Michigan, serving Black and brown birthing people. There is a lot that we don't hear about in the newspapers. We hear the bad news in the newspapers. I encourage people to look to reproductive justice organizations, to become a member, to attend their conferences. Sister Song Women of Color Collective for Reproductive Justice is one. Black Mamas Matter is another, which sponsors annually the Black Maternal Health Week. There's a great conference that's coming up in August called Let's Talk About Sex in DC, and there's special rates for students. We now have a sexual reproductive justice hub at CUNY School of Public Health, which is incredibly exciting. There's new research and opportunities happening in this hub, and there will be a discipline of sexual reproductive justice at CUNY. There is a lot going on around the country, and the Bureau of Maternal Infant Reproductive Health, New York City Teens Connection, is an initiative that I encourage people to look up to see what's happening all over the country around offering evidence-based sex education in high schools, connecting young people to services where they treat teens with respect and confidentially without parental involvement if the parent can't or the teen doesn't want them to be involved. And they did an incredible video campaign done by the teens on consent. And one of the things that we talked about in my class is sexual violence and the prevalence of it around our country. Angela Davis refers to it as a pandemic in terms of the numbers reached more than affected around globally. And one of the things to do about that is for young people to learn early on what are respectful, consensual relationships, and to understand what is okay and what isn't okay, and to feel empowered to develop those healthy relationships and to not go forward and have sex if they're not ready. Those kinds of learnings are key to preventing sexual violence. So public health is most importantly about primary prevention and building the society and making the changes that are necessary to promote health for all.
Great. What advice do you have for others who are looking to get involved and become more knowledgeable about reproductive justice and maternal health?
For students and even recent graduates, one way to get more knowledgeable is to think about working as an HRTP at the New York City Health Department and seeing if there are opportunities at the Bureau of Maternal, Infant, and Reproductive Health. Another is following me on LinkedIn, because I'm always sharing information about maternal health and reproductive rights and reproductive justice on LinkedIn. I'm happy to connect with anyone who wants to connect with me. I encourage folks to look to reproductive justice organizations all over the nation. I mentioned a few of them, and there's so much going on. If you just Google reproductive justice, but I've also compiled a list of many of the reproductive justice organizations. I'm happy to share that with you and make that available to students and faculty so that people can just start looking at these different organizations, attending their conferences, reading about all of this. I mean, you can't escape reproductive health and rights in the news. Almost every day there's a story. And there is so much out there to read about and so much going on to promote and fight for reproductive justice. So I encourage people to look to all those different resources. Just this month in May, one of the ways for free is to attend some of the events being led by the Postpartum Awareness Campaign. And you can go to the site Speak, Move, Change and sign up to attend any of 7 evenings of activities that will be sponsored, and you will have a chance to learn a lot. This will be specifically maternal health, but there's much that you can learn about sexual and reproductive health through many of the other organizations as well.
So, Deb, what makes public health personal to you?
I'm a mom with 2 children and was lucky enough to be able to go to a midwife for my prenatal care. And even when I needed a cesarean section, the first time I gave birth, I was at a hospital that supported midwives, and my midwife was there at my childbirth taking pictures. And I know the experience of feeling the respect, of feeling that I was with a provider who had a holistic approach to childbirth and pregnancy. That's what midwives have. And that's one of the key strategies I've been involved in, is promoting midwives, birthing centers, and more Black and brown women being able to have a pathway to become midwives, including tuition. So that's one piece of it. I've had my own bad experiences getting reproductive health care and being treated disrespectfully, or things being assumed about me starting from when I was a teenager, being told I had a sexually transmitted infection when I didn't, and being mistreated. So I had that personal experience. And I think growing up, raising children, and from an early age, knowing how important it was for them to know about their bodies, I made a point of my daughter knowing the word vulva. And she was the only kid who talked about her vulva and not her vagina. And I think I felt so strongly that I wanted my daughter to feel comfortable and good about her body and understand the different parts of her genitals and know what condoms were. Personally, I have friends who've experienced traumatic births. I'm very close friends with someone, Shawnee Benton Gibson, who brought me into the fold of the Postpartum Awareness Week, whose daughter, Tremonti Makiba Gibson, died after giving birth from a preventable cause of death. And one thing I forgot to mention is I encourage people to watch the film Aftershock. You can get it on Hulu, and it tells the story of Tremonti Makiba Gibson and others. So I know personally, not myself, but others, Black women who have experienced incredible trauma, and I see the impact it had on them. And losing your daughter from a pregnancy-related death, and to be friends with and colleagues with someone where that happened, feels personal to me, though it didn't happen to me personally. So yes, I see this in my life, and I see it affects me personally. I have a stake in this. I'm not just an ally. I'm a fighter alongside all the people fighting, because I want my granddaughter, who's now 10, to have the right to make decisions about her own body. If she has a pregnancy she doesn't want to continue, to be able to have an abortion and have access to it, to have access to birth control if she wants it, to have the right to love whoever she wants to love. All of those things are very personal to me, and they connect very much to the right of all people to have those rights.
Well, the work you're doing is definitely helping future generations, for sure.
Thank you.
When we come back, we'll chat with award-winning filmmaker Tonya Lewis-Lee about her documentary called Aftershock. If you're a storyteller or a filmmaker looking to share deeply personal stories that make an impact, you definitely don't want to miss this one. So stick around, we'll be right back.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
Welcome back to Making Public Health Personal. Our next guest is proof that there are many ways to make a difference on social justice issues that are important to you. Tonya Lewis-Lee is a director, producer, and writer whose work often explores the personal impact of social justice issues. She was executive producer of the series She's Gotta Have It, and she produced the film Monster, which premiered at the 2018 Sundance Film Festival. You can watch Monster and She's Gotta Have It on Netflix. Most recently, Tonya co-directed and co-produced the documentary film Aftershock. which examines the U.S. maternal mortality crisis. Aftershock is now streaming on Hulu. IndieWire named Tonya as one of the 22 rising female filmmakers to watch in 2022, and now I'm so pleased to welcome her here to the podcast. Hello, Tonya. Thanks for joining me.
Hi, happy to be here.
So our podcast usually speaks to public health researchers to break down these important social justice issues. And something I love about the film Aftershock is how personal the stories are that you shared. And yet you grounded those stories in real data and facts about the maternal health crisis. So I'd love to hear about the pre-production experience. How did you find these participants who were so willing to share their story?
Well, it's interesting. We met both families at very early stages within their grief. So Shamani Gibson's family, Shamani passed away in October of 2019. And in December of 2019, her mother, Shawnee Benton Gibson, and her partner, Omari Maynard, decided to host a celebration of life for Shamani. And they put out essentially a call on Instagram welcoming community to come celebrate Shamani's life and at the same time have a conversation about what was happening in community around maternal mortality and morbidity. Shawnee is someone who is very aware. She's a reproductive justice activist in her own right. And so my partner, Paula, saw that on Instagram and reached out to Shawnee and told her that she and I were working on the film, that Dawn Porter was on the film, and asked if we could come and film their celebration of life. And Shawnee agreed. And so that was the beginning of our journey with Shawnee and Omari. And then we began filming with her and him. And then in April of 2020, Amber Rose Isaac passed away. And I want to say within a week of Amber passing away, her partner, Bruce McIntyre, held a press conference. And he put that out also on Instagram. It was open to the public. So we sent someone to film his very first press conference. And then after that, we reached out to him. Omari had already reached out to him, as he is wont to do when another man loses a partner to maternal mortality or to childbirth complication, told him ultimately about us. We met with Bruce. I remember that very first conversation with Bruce. It was so raw. It was so fresh. And yet he wanted to tell the story about what happened to Amber so that people understood what happened to her and to try to do things to stop it so that it didn't happen to other families. So it was, I will say, meeting people so early in their grief is a very difficult thing. It's very painful, obviously, for them, but it's painful for us too. Together, we all wanted to try to raise awareness and make a difference. So we went on the journey together.
And as a filmmaker, how was it to be treading lightly with someone's grief when you're trying to get the footage you need and tell the story? You want to show them in the best light, but you also want to be sensitive to it. How was that for you?
Yeah, 100%. For me, just being aware that this is what's happened to them and just being a human being, treating people the way you would want to be treated, honoring their space and making sure that they were okay with the things that we were asking. Now, mind you, the pandemic hit awfully quick. So we met them December. Amber passed away in April. So we're still pretty much locked down. But what we did, we gave people iPhone cameras so that they could film themselves during that heavy lockdown period. And maybe that gave us a little space, but we still were in conversation with them on a regular basis, really checking to see what they would be comfortable with sharing. But I think the iPhone cameras, in an odd way, gave us all a little room and space for them to start putting their feelings down before we actually were able to film them in person again later in the summer. I mean, look, we considered them our collaborators in this film. We weren't going to do anything that was going to, like you say, make them look in a bad light. We were all on a mission to tell a story, to raise awareness, to make a difference. And so they collaborated with us, essentially.
They sure did. Especially I saw the film and was amazed that you were able to show a woman giving birth and that whole beautiful process. It was amazing. I was like, wow, this is a really nice way to round out this story.
Yeah, I appreciate you saying that, because the thing that I think we all really want people to come away with is not a fear of birthing, but this idea that there are solutions so that women can have amazing births and wonderful outcomes. Our system is not really set up for it, but there are ways to do that. And being able to capture Felicia's beautiful birth, someone said to us, "Oh, it felt a little long," but I guess that's the point. Yes, birth takes time. This is not,
Yeah.
it doesn't happen on your schedule. It happens on its own schedule. And for her to allow us into that intimate moment with her and her family, I think it was extremely meaningful, not just to us in the film, but to many who see it.
Absolutely. And Aftershock shines a light on the fact that the U.S. maternal mortality crisis is not just a women's issue, but it's a human rights issue. And your film offers a number of potential solutions and ways to get involved. Can you share the most important takeaways for our audience here?
Well, I will say that I think that when we think about birthing, there are many ways to give birth. People can give birth in a hospital with a doctor. You can give birth in a hospital with a midwife. You could give birth with a midwife and a doula at a birthing center. A doula can also come into the hospital situation. People may want to give birth at home with a midwife and a doula, but a doctor on call. So I hope that the takeaway of the film for some people is that there is choice in how you birth. And it becomes incumbent upon us to find what the options are and really figure out what's best for that particular woman and family. I think the other thing is that when we center women in making sure, or birthing people, and making sure that they are the ones that are making sure they have the right support around them so that they can focus and feel safe to give birth in the best way possible, then we can have better outcomes. And the final thing I'll say is that along those lines, the United States is the only industrialized nation that does not have midwifery care integrated into women's health care. We are a country where if a midwife has one terrible tragedy, we're ready to throw out all midwives. But if a doctor has one terrible tragedy, no one's ready to throw out all the doctors. So I think that we need to rethink the way we think about midwifery as part of overall women's health care. And I think we would see our outcomes improve.
Absolutely. And something that stood out to me as someone who gave birth about 2 years ago at this point, but something that stood out to me in the film was a lot of these women who had issues were not so comfortable speaking to their doctor either before or after the birth process. And finding a doctor or midwife or whoever is your caretaker that will be responsive and make you feel supported and make you feel like, you're not crazy for calling me in the middle of the night when you have pain or a chest pain or whatever. That's really important.
Yeah, being seen and heard.
Yes.
Seen and heard. Women, we know our bodies. We know when something is not really right, and we don't need people to tell us, "Oh, you're crazy," or, "Oh, just go sit down, you'll be fine." We need to be seen and heard.
And your film is proof that we can make a difference in public health and in people's lives through communication and storytelling. So what message do you have for students maybe at our school or other people who are passionate about a social justice issue or a public health issue and want to do something about it?
Jump in and do it. Don't hesitate. I think that we all have a role to play in improving our systems and ways of doing things. And if you feel the passion within you, that means that you've got a wherewithal to make a difference in your way. So I would say figure out what your role is and jump in and start. And it's a journey. You never know. When I first started advocacy work, I was not a public speaker. I didn't really talk to lots of different kinds of people. And I've been able to really, I feel, make an impact. And I'm really proud of that. And I don't know that I knew that I could, but I did just because I started.
Absolutely. And you're using the skills that you have and bringing that to the table, I think is really inspiring because not everybody is comfortable with being that public person and that person right in front. But if you could be behind the camera, I find that really inspiring.
Exactly. I agree. I mean, there are all kinds of ways, and we need all kinds of different ways. Everybody can't do it the same way. That's how you make change. All hands on deck, all skill sets on deck.
And so creating a feature-length documentary is definitely a process and it takes quite a bit of time. But I found that the reward is what you learn from the process itself. So what did you learn from the filmmaking process for Aftershock?
That's a really great question. Well, we had a really incredible team of diverse, mostly women on the project. And I think that working with different people with different walks of life, different lived experiences can really inform a story, a way of thinking that is really powerful. So the diverse thoughts and ways of approaching things, I think, is something that I knew, but I definitely felt in this process of making the film. And I would say that again, I feel like what I learned in the filmmaking process as well is that sometimes you just have to get started. You don't know where you're going exactly. You have an idea and you just have to roll with it and let it unfurl. And it's a really amazing thing when you embark on a journey without fully knowing where you're going to land. And then ultimately you will land and you will make it happen. And it's great.
Definitely. And you were saying about the iPhone cameras, and I think that's really helpful for our students who are studying maybe communication for social change at CUNY SPH, students who are trying to be storytellers and trying to spread awareness about different social justice issues, but they don't maybe have the resources to create a documentary film. But obviously you have a production team, but it's proof that you don't have to have all the resources to actually get good footage and get a film going.
Absolutely. And we didn't have all the resources as at first. We had to go out and find the money. We had to go out and put the team together. But I think you raised, when you mentioned the iPhone cameras too, that you have to be nimble, you have to be flexible, you have to be resourceful. When we initially started making this film, we didn't know a pandemic was going to come. We had plans about how we were going to make the film, and we had to adjust based upon the world in which we were now living, and adjust we did. So I think you have to be creative and nimble and, again, also willing to work really hard.
Yeah. And so something I always ask our guests on this podcast is what makes public health personal to them. And so I'll shift it a little for you, but what makes filmmaking and social justice personal for you?
Well, I've been coming to realize now, when I was a little girl, I moved from a rather diverse community to a very white community where I was bullied relentlessly for my race. And at the same time, some years after that experience, I discovered the Eyes on the Prize documentary series that highlighted these civil rights heroes who were making change for people. And so for me, when I think about health, public health, and just filmmaking, it's personal to me because the films I make are trying to improve the world. And it may sound lofty, but it's true. I'm trying to show the humanity of what it means to be a diverse person in a world. And I think storytelling is the way in which we can change hearts and minds by showing what the universal human condition and experience is. And so it's personal to me because I'm trying to right the wrongs of, I think, what I went through as a child, and at the same time, trying to make it better for those that come along. So showing some that, like, you don't have, even if you go through a tough experience, you can come out on the other side and be stronger, right? And it doesn't end there. So I'm trying to make a difference, and it matters to me personally, for myself, for my children, for my community, for the entire human condition. When I look at where we are in this world right now, we need to fight for our humanity, all of us. We are really in a fight for our humanity. We cannot care just for ourselves. We must care for all people on this planet. That's how we ensure that there's a future for our children, our grandchildren, our great-grandchildren.
Well, that's a perfect note to end on. Thanks to Tonya and Deb for being our guests today, and thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. You can now share, like, and subscribe to our show anywhere podcasts are heard and on our YouTube channel. To find out more about our school, you can visit sph.cuny.edu or connect with us on social media. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal. Have a great summer, everyone.